Question 1. A 62-year-old male undergoes a complete transthoracic echocardiogram with spectral Doppler and color flow Doppler for evaluation of new-onset shortness of breath and pedal edema. What CPT code should be reported? A. 93307. B. 93308. C. 93307, 93320, 93325. D. 93306. Answer: A. 93307. This question tests the understanding of CPT coding for echocardiography, specifically distinguishing between complete and limited studies. The keyword complete transthoracic echocardiogram with spectral Doppler and color flow Doppler indicates that all components of a comprehensive echocardiogram were performed. Code 93307 represents a complete transthoracic echocardiogram, which inherently includes spectral Doppler and color flow Doppler when performed, making separate codes for these components inappropriate. For instance, if only a specific chamber's function was assessed, a limited echo code like 93308 would be used. Always remember that comprehensive codes like 93307 are global and encompass all included components, so don't unbundle them. Question 2. A patient with a history of COPD exacerbation and chronic bronchitis with emphysema presents with acute respiratory failure. What is the correct sequencing for ICD-10-CM codes? A. J44.1, J96.00. B. J96.00, J44.1. C. J43.9, J44.1, J96.00. D. J96.00, J44.9. Answer: B. J96.00, J44.1. This question focuses on the correct sequencing of ICD-10-CM codes when acute respiratory failure is the reason for the encounter in a patient with an underlying chronic respiratory condition. The keywords acute respiratory failure and COPD exacerbation are crucial. When acute respiratory failure is clearly the reason for admission or the primary condition being treated, it is coded first. The underlying cause, in this case, chronic obstructive pulmonary disease with acute exacerbation, is then coded as a secondary diagnosis. This sequencing accurately reflects the patient's primary reason for care and their underlying chronic condition. Question 3. A physician performs a cardiac catheterization, left heart, for coronary angiography and ventriculography. Selective catheterization of 2 coronary arteries and an aortic root injection are performed. What CPT code should be reported? A. 93458. B. 93459. C. 93458, 93567. D. 93460. Answer: A. 93458. This question assesses the CPT coding for cardiac catheterization procedures, specifically left heart catheterization with coronary angiography. The keywords are cardiac catheterization, left heart, coronary angiography, ventriculography, and selective catheterization of 2 coronary arteries. Code 93458 describes a left heart catheterization including selective coronary angiography, with or without ventricular and/or atrial angiography, and injection procedures. The performance of ventriculography is included within this comprehensive code, as is the selective catheterization of 2 coronary arteries. Always remember to look for the most comprehensive code that accurately describes all performed services to avoid unbundling. Question 4. A patient undergoes spirometry before and after the administration of a bronchodilator. What CPT code should be reported? A. 94010. B. 94010, 94060. C. 94060. D. 94,070. Answer, C. 94060. This question tests the CPT coding for pulmonary function tests, specifically spirometry with bronchodilator response. The crucial keywords are spirometry and before and after the administration of a bronchodilator. Code 94060 specifically describes spirometry, which includes a before and after bronchodilator administration component. Code 94010 is for spirometry without a bronchodilator, and codes like 94070 are for complex tests involving serial measurements or provocation. When a bronchodilator is given as part of the test, always use the code that explicitly includes this service to ensure accurate reporting. Question 5. A 45-year-old patient presents with shortness of breath and wheezing due to acute exacerbation of moderate persistent asthma. What is the correct ICD-10-CM code? A. J45.40. B. J45.41. C. J45.50. D. J45.51. Answer, B. J45.41. This question focuses on accurate ICD-10-CM coding for asthma, requiring attention to the severity and exacerbation status. The key terms are moderate persistent asthma and acute exacerbation. Code J45.41 specifically identifies moderate persistent asthma with acute exacerbation. Codes in the J45 category are highly specific, differentiating asthma based on its severity, intermittent, mild persistent, moderate persistent, severe persistent, and whether an acute exacerbation or status asthmaticus is present. Always ensure you capture both the severity and the presence of any exacerbation for precise asthma coding. Question 6. A physician performs an initial insertion of a permanent dual-chamber pacemaker system. What CPT codes should be reported for the insertion of the generator and leads? A. 33206, 33207. B. 33208. C. 33208, 33216, 33217. D. 33208, 33213. Answer, B. 33208. This question evaluates the CPT coding for permanent pacemaker insertion, emphasizing the comprehensive nature of certain codes. The keywords are initial insertion, permanent, and dual-chamber pacemaker system. Code 33208 is specifically for the insertion of a permanent pacemaker with a dual-chamber transvenous electrode system, which includes the insertion of both the generator and the two leads. It is crucial to use the single comprehensive code that encompasses the entire system insertion rather than unbundling into separate lead and generator codes. Remember, when a code describes the insertion of an entire system, it typically includes all necessary components unless specified otherwise. Question 7. A patient with chronic systolic heart failure presents for an office visit. The physician performs a detailed history, detailed exam, and moderate complexity medical decision-making. What E/M code should be reported? A. 99,203. B. 99,204. C. 99,213. D. 99,214. Answer, D. 99214. This question assesses E/M coding for an established patient, focusing on the components of the visit based on the 2021 E/M guidelines. The keywords are chronic systolic heart failure, indicating an established patient, detailed history, detailed exam, and moderate complexity medical decision-making. For established patient office visits, coding is primarily driven by medical decision-making, MDM, or total time. Since the MDM is moderate complexity, code 99214 is appropriate. For instance, if the MDM was low complexity, a 99213 would be more fitting. Always prioritize MDM or total time for established patient office visits under the current E/M guidelines. Question 8. A physician performs a diagnostic bronchoscopy with brushings of a lesion in the right main bronchus. What CPT code should be reported? A. 31622. B. 31623. C. 31622, 31623. D. 31625. Answer B. 31623. This question tests the CPT coding for bronchoscopy with diagnostic procedures. The keywords are diagnostic bronchoscopy and brushings of a lesion. Code 31623 specifically describes bronchoscopy with brushing or protected brushings. Code 31622 is for a diagnostic bronchoscopy without additional procedures, while other codes like 31625 involve biopsy. When a specific diagnostic technique like brushing is performed, select the CPT code that accurately reflects that intervention. Always choose the most specific CPT code that fully describes the procedure performed during the bronchoscopy. Question 9. A patient is diagnosed with essential, primary, hypertension and benign prostatic hypertrophy. What ICD-10-CM code should be reported? A. I10, N40.0. B. I10, N40.1. C. I10, N40.0, N40.1. D. I10, N40. Answer A. I10, N40.0. This question tests the ability to assign ICD-10-CM codes for common co-occurring conditions, ensuring proper specificity. The keywords are essential, primary, hypertension, and benign prostatic hypertrophy. Code I10 is for essential, primary, hypertension. For benign prostatic hypertrophy, N40.0 is the correct code for benign prostatic hyperplasia without lower urinary tract symptoms, as no symptoms are mentioned. Code N40.1 would be used if lower urinary tract symptoms were present. Always remember to select the most specific code available that accurately reflects the documented condition. Question 10. A physician manages a critically ill patient in the intensive care unit for 75 minutes on a specific date. What CPT code should be reported for this critical care service? A. 99291. B. 99292. C. 99291, 99292. D. 99291X2. Answer C. 99291, 99292. This question evaluates the CPT coding for critical care services, emphasizing time-based reporting. The keywords are critically ill patient, intensive care unit, and 75 minutes. Code 99291 is used for the first 30 to 74 minutes of critical care. Since the physician spent 75 minutes, the initial 99,291 covers the first 74 minutes, and then 99,292 is reported for each additional 30 minutes. An additional 30-minute unit of 99,292 is billed for time spent between 75 to 104 minutes, which applies here. Always remember to accurately calculate the total critical care time to apply the correct initial and add-on codes. Question 11. A 70-year-old male undergoes a complete replacement of his permanent pacemaker pulse generator due to battery depletion. The leads remain in place. What CPT code should be reported? A. 33227. B. 33228. C. 33229. D. 33233. Answer B. 33228. This question tests the CPT coding for replacement of pacemaker components, specifically the pulse generator. The keywords are complete replacement, permanent pacemaker pulse generator, and battery depletion, with the note that the leads remain in place. Code 33228 is for the replacement of a permanent pacemaker pulse generator for a dual-chamber system. Code 33227 is for a single chamber, and 33229 is for multiple lead systems, such as a biventricular device. Always confirm the type of pacemaker system, single, dual, or multiple leads, when selecting codes for generator replacement. Question 12. A patient presents with acute bronchitis with bronchospasm. What is the correct ICD-10-CM code? A. J20.9. B. J40. C. J20.9, J44.9. D. J20.9, J98.8. Answer A. J20.9. This question tests the ability to assign an ICD-10-CM code for acute bronchitis when bronchospasm is also present. The keywords are acute bronchitis and bronchospasm. The condition acute bronchitis with bronchospasm is implicitly included under the code for acute bronchitis, unspecified, J20.9, as there isn't a more specific code that explicitly combines these two terms as a single diagnosis in ICD-10-CM. In this scenario, bronchospasm is a symptom or manifestation of the acute bronchitis. When coding, default to the most general code for acute bronchitis unless further specificity like a bacterial cause is stated. Question 13. A physician performs a stress echocardiogram, including a resting echocardiogram and a treadmill exercise test. What CPT code should be reported? A. 93,350. B. 93,351. C. 93,015. D. 93350, 93015. Answer B. 93351. This question assesses the CPT coding for a complete stress echocardiogram. The keywords are stress echocardiogram, resting echocardiogram, and treadmill exercise test. Code 93351 is a comprehensive code for a stress echocardiogram, encompassing both the resting and stress portions, as well as the technical and professional components of the stress test itself. Code 93350 is for the professional component only, and 93015 is for a complete cardiovascular stress test without the echocardiogram. Always select the single, comprehensive code that covers all aspects of the stress echocardiogram, including the stress test component. Question 14. A patient is admitted to the hospital with acute exacerbation of chronic obstructive pulmonary disease, COPD, and subsequent pneumonia. What ICD-10-CM code should be reported, and in what order? A. J44.1, J18.9. B. J18.9, J44.1. C. J44.9, J18.9. D. J44.1, J15.7. Answer A. J44.1, J18.9. This question tests the ICD-10-CM coding for COPD with an acute exacerbation and subsequent pneumonia. The key terms are acute exacerbation of chronic obstructive pulmonary disease and subsequent pneumonia. When COPD with exacerbation is clearly linked to pneumonia, the code for COPD with acute exacerbation, J44.1, is sequenced first, followed by the code for the type of pneumonia, J18.9 for unspecified pneumonia, if no specific organism is identified. The subsequent implies the pneumonia developed in the context of the exacerbation, making the COPD the primary condition driving the exacerbation. Always follow official guidelines for combination codes and sequencing when conditions are causally linked. Question 15. A physician performs an operative thoracoscopy with wedge resection of a lesion in the left lower lobe of the lung. What CPT code should be reported? A. 32663. B. 32666. C. 32650. D. 32668. Answer A. 32663. This question focuses on CPT coding for thoracoscopic lung procedures. The crucial keywords are operative thoracoscopy and wedge resection of a lesion. Code 32663 specifically describes a thoracoscopy, surgical, with therapeutic wedge resection of lung. Code 32666 is for a segmentectomy, which is a larger resection, and 32650 is for diagnostic thoracoscopy with biopsy. When a wedge resection is performed via thoracoscopy, choose the specific code that identifies this procedure. Always differentiate between diagnostic, wedge, and larger resections when coding thoracoscopic lung surgeries. Question 16. A patient with symptomatic bradycardia receives a permanent single-lead pacemaker for the atrium. What CPT code should be reported for the insertion of the pacemaker system? A. 33206. B. 33207. C. 33208. D. 33216. Answer A. 33206. This question assesses the CPT coding for the insertion of a single-chamber permanent pacemaker. The keywords are permanent single-lead pacemaker and atrium. Code 33206 is specifically for the insertion of a permanent pacemaker with a single transvenous electrode system in the atrium. Code 33207 is for a single-lead ventricular system, and 33208 is for a dual-chamber system. It is important to identify whether the pacemaker is single-chamber, atrial or ventricular, or dual-chamber to select the correct insertion code. Always confirm the chambers where the leads are placed when coding pacemaker insertions. Question 17. A patient with chronic heart failure has a left ventricular ejection fraction of 35%. Which ICD-10 cm code is appropriate? A. I50.20. B. I50.30. C. I50.21. D. I50.32. Answer C. I50.21. This question tests the specific ICD-10 cm coding for heart failure based on left ventricular ejection fraction, LVEF. The keywords are chronic heart failure and left ventricular ejection fraction of 35%. An LVEF of 35% indicates systolic heart failure, reduced ejection fraction. Therefore, the correct code is I50.21, which specifies chronic systolic, congestive, heart failure. Codes like I50.31 would be for diastolic heart failure, preserved ejection fraction, while codes ending in 0 indicate unspecified laterality or no specific LVEF information. Always look for documentation of the ejection fraction to accurately classify heart failure as systolic, diastolic, or combined. Question 18. A physician performs a diagnostic right heart catheterization including a right ventricular angiography. What CPT code should be reported? A. 93451. B. 93452. C. 93453. D. 93451, 93567. Answer B. 93452. This question focuses on CPT coding for right heart catheterization, specifically when a right ventricular angiography is performed. The keywords are diagnostic right heart catheterization and right ventricular angiography. Code 93452 specifically includes right heart catheterization with right ventricular angiography. Code 93451 is for a right heart catheterization without angiography. The angiography is an integral part of this service. Always look for the most comprehensive code that includes all performed components, especially when angiography is part of the diagnostic catheterization. Question 19. A patient with severe persistent asthma presents with status asthmaticus. What is the correct ICD-10-CM code? A. J45.50. B. J45.51. C. J45.52. D. J45.909. Answer: C. J45.52. This question tests the precise ICD-10-CM coding for severe persistent asthma when the patient is experiencing status asthmaticus. The key terms are severe persistent asthma and status asthmaticus. Code J45.52 accurately represents severe persistent asthma with status asthmaticus. ICD-10-CM provides very specific codes for asthma, differentiating not only by severity, intermittent, mild, moderate, severe persistent, but also by the presence of exacerbations or status asthmaticus. Always ensure you capture the highest level of detail regarding both the asthma's severity and its acute presentation. Question 20. A patient receives a 24-hour Holter monitor with a recording system and physician interpretation and report. What CPT codes should be reported? A. 93,224. B. 93,225. C. 93224, 93227. D. 93224, 93226. Answer: A. 93224. This question assesses the CPT coding for Holter monitoring, specifically the comprehensive service. The keywords are 24-hour Holter monitor, recording system, and physician interpretation and report. Code 93224 represents the complete service for a 24-hour, or longer, up to 48 hours, Holter monitor, including the recording, scanning analysis, and the professional interpretation and report. Code 93225 is only for the recording, and 93226 is for the scanning analysis with report. Always select the global code when the provider performs all components of the Holter monitoring service. Question 21. A patient presents with acute myocardial infarction, MI, of the anterior wall, initial episode. What is the correct ICD-10-CM code? A. I21.01. B. I21.02. C. I21.09. D. I21.11. Answer: A. I21.01. This question tests the precise ICD-10-CM coding for acute myocardial infarction, requiring attention to both the location and the encounter type. The keywords are acute myocardial infarction, anterior wall, and initial episode. Code I21.01 specifically identifies ST elevation, STEMI, myocardial infarction of the anterior wall, initial encounter. ICD-10-CM MI codes are highly granular, requiring distinction between STEMI and STEMI, specific wall involvement, e.g., anterior, inferior, lateral, and whether it's an initial, subsequent, or old MI. Always verify all these details in the documentation for accurate coding. Question 22. A physician performs an atherectomy, percutaneous, of a single coronary artery. What CPT code should be reported? A. 92,920. B. 92,928. C. 92,933. D. 92,937. Answer: B. 92928. This question focuses on CPT coding for percutaneous coronary interventions, PCI, specifically atherectomy. The keywords are atherectomy, percutaneous, and single coronary artery. Code 92928 describes a percutaneous transluminal coronary atherectomy, without stent or balloon. Codes like 92920 are for percutaneous transluminal coronary angioplasty, and 92933/92937 are for interventions on bypass grafts. It is important to differentiate between angioplasty, atherectomy, and stent placement when coding PCIs. Always identify the specific type of interventional procedure performed on the coronary artery. Question 23. A patient presents for a follow-up visit for COPD. The physician performs a problem-focused history, an expanded problem-focused exam, and low-complexity medical decision-making. What E/M code should be reported? A. 99,202. B. 99,203. C. 99,213. D. 99,214. Answer: C. 99213. This question evaluates E/M coding for an established patient office visit based on the 2021 E/M guidelines. The keywords are follow-up visit for COPD, indicating an established patient, problem-focused history, expanded problem-focused exam, and low-complexity medical decision-making. For established patient office visits, coding is primarily determined by medical decision-making, MDM, or total time. With low-complexity medical decision-making, the correct code is 99213. If the MDM was straightforward, a 99212 would be used. Always prioritize the level of medical decision-making or total time when selecting E/M codes for established patient office visits. Question 24. A patient has a chronic cough and is diagnosed with acute tracheobronchitis due to Mycoplasma pneumoniae. What ICD-10-CM code should be reported? A. J20.9. B. J20.0. C. J20.0, B. 96.0. D. J40. Answer: B. J20.0. This question tests the specific ICD-10-CM coding for acute tracheobronchitis when the causative organism is known. The crucial keywords are acute tracheobronchitis and due to Mycoplasma pneumoniae. Code J20.0 is specifically for acute bronchitis due to Mycoplasma pneumoniae. ICD-10-CM often provides combination codes that include both the condition and the causative organism, which is preferred over coding the organism separately. When the documentation specifies the infectious agent, always look for a combination code that incorporates both the condition and the etiology. Question 25. A physician performs a bilateral comprehensive screening mammography. What HCPCS Level 2 code should be reported? A. 77067. B. G0202. C. G0204. D. G0206. Answer: B. G0202. This question assesses the use of HCPCS Level 2 codes for screening services, specifically mammography. The keywords are bilateral comprehensive screening mammography. For Medicare patients, code G0202 is used to report screening mammography, producing a separate physician interpretation. While CPT code 77067 exists for screening mammography, Medicare often mandates the use of G codes for certain services, particularly screening. Always be aware of payer-specific coding requirements, as government payers like Medicare often have their own specific codes for screening services.